So I'd like to thank everyone for joining us for session 4 of the weekly COVID-19 webinar update. As in previous weeks, we encourage you to submit your questions via the Q&A box. Questions received will be responded to during the webinar as time allows. However, all questions will be reviewed and answered, and the follow-up document will be posted on our website as in the previous weeks. Also, as we've shared numerous times, all COVID-19 guidance and information is being posted on the Division's COVID-19 webpage. This webpage can be accessed by going to the Division's homepage, www.dmh.mov/DEV-disabilities. If you click on the first panel in that large carousel, the panel says COVID-19 updates as available. That will take you directly to our COVID-19 page and all the information that we've been putting out. So we've also added an additional button this week for submission of stories from the field. You should see that on your screen, that green bar that's at the top. Because we know there are a lot of great things going on out there, we're asking for folks to share those stories with us so that we can in turn share them with all of you. We have received a couple of those submissions already, and as we speak, IT is building us a fancy schmancy new button to go right under that yellow box that says Get Email Updates. That should be there anytime today. You'll be able to click on that button and access those stories that have been submitted by folks and get some great information there. And with that, I believe that's all that I have to share. So we have our team of folks here to provide you with updates on various items as they pertain to COVID-19. And I'm going to turn it over to our Division Director, Val Hoon.
Good morning, everybody, and thank you for joining us again. Like I say every week, one Friday is one Friday. It changes how we're addressing this change every week. I am excited, though, because I do think we're going to be able to start pushing out some more data regionally so that we can make sure that you guys are prepared as possible. So first thing, let's talk about, and I know the governor mentioned it in his press conference yesterday, but the state of Missouri has a fusion team around healthcare and coordination of regional healthcare. And the whole goal of this fusion team is to help flatten the curve so that we can save lives. And we are the Department of Mental Health is a part of that fusion team. I am specifically a part of that fusion team. So I wanted to kind of give you just a background on some of the stuff that we're working on. While we do have a group of folks that work on state-operated facilities and management and state-operated facilities, which is great because we're able to transition a lot of that knowledge to you all as you come across your first positives. But we also are working on recognizing the value of all healthcare providers in the system. And that goes all the way down to a personal care attendant in someone's home to a group home residential provider for us, but it's across the system. And one of the things the Fusion Cell wants to make sure is that all of our healthcare providers in the system have access to information timely. So we will start pushing out, hopefully I get out a first email today to everybody, but we will also be pushing out stuff regionally specific, statewide specific that can hopefully help you guys manage the volume of information you are getting. And so that's really the goal of this group. It will also inform you of where we see potential hotspots emerging so that you guys can really be thinking through, are we doing everything we can to make sure we can avoid being part of this hotspot? So I just want to give you kind of an update on some of those numbers right now. These are yesterday's numbers, and I know how hard it is to keep up with the numbers because it's hard for me, and I'm right here in the middle of it. But yesterday, there were 3,539 cases of COVID positive in Missouri, and there were 77 deaths. There's COVID positive cases in 87 counties in Missouri right now. Of course, the St. Louis area is considered a hotspot. Anybody in the St. Louis area understands that, I believe. But there's also emerging hotspots around the state. And when we say emerging, those are places that we're monitoring because the number of new cases seem to be higher than what you would have expected. So an idea of a location that we're monitoring right now is really that I-55 corridor south of St. Louis. All of the counties along the Mississippi River there have seen an increase in cases, new cases in the last 2 days. And so that's information I think that's important for our providers in that area, and we'll try to push that out. Also, we'll try to push out some specific county data whenever we come across that. Right now, we're really monitoring Perry County, Franklin County, and Camden County. Those 3 counties seem to see an increase in positive cases that's higher than other counties in the state. So that doesn't mean that the world's on fire in those counties. Please don't take that as that. It's just those are places that we're starting to see numbers tick up, and we want to make sure that all of our healthcare providers, not just our hospitals, but all of our healthcare providers are ready to do the jobs that we need them to do, and we know how hard it is to do those jobs right now. So I think that's all I was going to talk about the Fusion team. The Fusion team will also work on PPE, and that is something I can't even tell you how many different groups of folks we have trying to coordinate this PPE, personal protective equipment effort. And while we were early on, we had a list of what our PPE needs were for both our community providers and our state-operated programs. That list is now almost a month old. So we're doing a small survey of some providers to get an idea of what their PPE needs are. If you've not been contacted, don't contact anybody. But I'm just telling you how we're getting that information. We will do a small survey of providers. Those will be providers that both have positive cases and don't have positive cases, to figure out what their 30-day PPE need is, and then we will transport that over to the overall PPE group. We are definitely on the personal protective equipment radar. I do want to make sure people understand that. Also, you have got to be using the crisis practices around personal protective equipment, because that is all that we have right now. So please, if you don't know what those are, reach out to your regional office and we will get you that information again. We are here to give you as much technical support as we can give you right now. So again, our goal is to keep you viable healthcare providers in the field, because we need you. The hospitals we do not want to overrun the hospitals, because we know that they need all the capacity that they can get right now. So I think those are my two big items right now. I mean, to give you an idea of where we are, what we know about COVID positive cases in the state for individuals with developmental disabilities. Our cases in our state-operated programs, both on the DBH side and the DD side, so that's the behavioral health psychiatric hospitals and the developmental disability facilities, all of our cases are limited to the St. Louis area at this point. Also, unfortunately, on the community side, we are not limited to the St. Louis area. We have cases in St. Louis area, the entire St. Louis metro area. We have some cases in rural Missouri, and we have cases in Kansas City. Again, I cannot reiterate enough how important it is that you guys report that information to us, and because we use that data for a lot of different things and to inform a lot of different things. And also, let us be your technical assistance resource, because more and more people are going to get really, really busy with this, and you need to take advantage of the folks that have really already got some experience in it. So with that, I am going to turn it over to Gary right now.
Good morning, Gary Schnauzmeyer. I'm just going to give you a brief update on Station MD, where we are with that we've talked about in previous calls. So we have given our first 5,000 names enrollment to Station MD, and we're making every effort right now to roll out communication to those folks that have been enrolled. So if you get enrolled, if you call information, if you call Station MD, they're going to verify that you've been enrolled, and they're going to check their enrollment information they've received from us. So just be aware of that. For residential providers, they are working on communicating with all the individuals they serve. And for in-home folks, we're taking a multiple avenue approach to contacting those folks through the division and through service coordination agencies. So we're making a couple different efforts to try and reach all the folks at home to let them know they've been enrolled and to send information. And the information, we're working on letters, a separate letter for families and individuals, and then a separate letter for providers, and even some information that providers can send in, residential providers can send to folks that they serve. We're also working on a packet that individuals and families can use that gives them all the information they need to know, how to get the app, information about the website and information that they can fill out and submit to Station MD. So Station MD has a little background information. So all that's coming. We're making the last changes to our website, and we should be able to flip the switch on that pretty soon. So when you get notification that you've been enrolled, you should be able to go to the website, and that's kind of a landing page, some information. And then there's a link to Station MD. It can take you directly to Station MD, and they've got a page set up specifically for the Division of Developmental Disabilities. And we hope to be able to be turning that on any day. And I'm looking at Wendy, if not today, maybe Monday. So that's the first 5,000. We're going to monitor that very closely to see how that goes. And then we're hoping to do the rest of all the Medicaid waiver participants in the next phase, which should be within a week to 2 weeks after that. Okay, I will turn it over to Angie Brenner, who's going to talk about our Appendix K.
Sorry, good morning, everyone. Hope everyone can hear me okay. We have been working on our Appendix K with MoHealthNet. Just so you got kind of a big picture, in the whole state or nation, 23 states have been approved on their Appendix K. We have been working closely, again, like I said, with MoHealthNet on our Appendix K. It is now over at the Office of Administration for review. And once they have, they're able to complete their review, provide us any feedback, we will submit it to CMS. When we do that, we will make sure to post it and share it with everyone. In the meantime, we'll also be working to update any provider guidance that we need to update so there's consistency across the guidance in Appendix K. And we'll keep working with providers on that. And we will be able to make updates to Appendix K. It's similar to the 1135 waivers that states are submitting. You can do several rounds of them, so please know that we'll submit our first round and we'll continue working with providers on any additional requests that we need to make and send up additional rounds as we need to, and we'll keep those posted. And then with that, I will turn it over to Kim.
Good morning, everyone. I just want to first of all acknowledge and appreciate all that everyone's doing at this time. A quick reminder for everybody to please not forget about how to support individuals right now to stay socially connected with their families and friends through technology. That's of utmost importance right now, just to kind of stay connected. Also want to just do a few quick reminders that we're constantly updating information on our website, as Heike mentioned earlier, and she has pulled up for you right now. Please make sure you're signed up for those email blasts. Heike sends out a daily notification on any updates, and as you know, with COVID-19, information is changing on a daily basis, and so we're trying to stay abreast and provide some responses in regards to some of the initial guidance that we posted. I also really appreciate everyone's questions. Please continue to forward those to the division. That really helps us to monitor and know where we need to provide additional information out to everyone and explore additional resources. Just a quick update for this week, what we've posted. We did, through the division, post some information on initial certification guidance for CPR First Aid and DMHDD Med certification. And we also conducted some revisions for the residential RN oversight. And so there's additional information provided there and posted now as well. Within some of the guidance, we've also shared that our current contracted providers have the ability through the Relias platform to access some good training information that's relevant right now, including hand hygiene, infection control basics, personal protective equipment, and transmission-based precautions. These are very quick tutorials, on average about 15 to 30 minutes each. Also, with our guidance that we posted this week, there's information from the Health Risk Screening Company, the HRST tool. They've developed a My Health Passport, which is available, accessible. It's a fillable document, 2-page front and back if you go to print it off. If you fill that information out ahead of time, it's a really good resource to educate and inform someone about who may not be familiar with an individual, and it includes information regarding their health and support information. And at this time, I'll turn it over to Wendy Witzik for additional information.
Good morning, everybody. I just have one thing to go over with you.
And just to kind of give you a heads up that this is what we are working on with Department of Health and Senior Services and Children's Division, is looking at our capacity to stand up emergency shelters as they may be needed for people with IDD who get displaced because of the COVID-19 virus. So this could be folks that show up at the hospitals with their parents or their caregiver who is ill with the virus, and now they have nowhere to go. So we'd be able to respond to that. Or it could be someone who is in the hospital and doesn't have the ability to transition anywhere for that 14-day quarantine time period after they're discharged from the hospital. So it could be a stopping place for them to transition back to home or their provider if their provider isn't able to provide that quarantine space. So we are working on that. There was a survey that went out to our provider network to see who might have space that they're not using that we could use for these emergency shelters, such as day programs or early childhood centers, or maybe it's a group home that isn't being used. The important thing is that we don't want to use anything that is a part of your or the provider's emergency response plan. So be sure to not shortchange yourself and your emergency response places if that's not included there. So the other piece of that survey is also to look where there might be staff available to help staff these shelters. So we're looking forward to probably pulling all that information together over the weekend. If you have not gotten that survey or if you've missed that survey, please send an email to ddmail@dmh.com or dmh.mo.gov, sorry. And we'll be sure to get that survey sent out to you again. So we'll be calling on people there as we identify spaces. Some providers may have space, some providers may have staff, some providers may have both. So we're looking for all of that, as well as a person that would be the site manager for that location if we have to stand it up. We're fortunate to have joining our team Becky Gear from our division, Department of Disaster Services, as well as Deb Hendricks from SEMA. So she has, they both have much experience in these kinds of operations, so we're looking forward to their expertise on the team. So look for more information on that as it comes out. And I'm not sure, I apologize, Kim, if you mentioned this, but we will post on the questions from this webinar, the website that you can go to find a document about preserving PPE and using that in your crisis planning. So with that, I'm going to turn it over to Val if she's got some follow-up answers to some questions that have come in.
Okay, so there's been a couple of questions that come in about emails they've seen that seem to contradict guidance that we have pushed out on 3/19/2020. At this time, the department is still operating under the guidance that we pushed out on 3/19/2020. That's March 19th, 2020. So that is the guidance you should be following at this time. Until we actually submit an Appendix K to CMS, we won't be changing that guidance. So, and that has not happened yet. Like Angie said, that Appendix K is still in the Office of Administration. So that is the guidance we're operating on. We are not going to change course until we need to change course, if we even need to change any courses. Also, Gary had a couple questions on Station MD that came in, so I'm going to let him address those, and I'm going to look and see what else we got on the line.
So I know somebody asked, excuse me, if Station MD was for residential services only. No, it's going to be all Medicaid waivers. So it'll be in-home and residential. It's just we're separating our communication between the residential providers and the in-home folks. And then also somebody asked, if you're not enrolled, can you still call? And unfortunately, no. Station MD is going to be checking the list of individuals we submit to them to see if you're an enrolled person. But we are going to try and get everyone else in Medicaid waiver enrolled as quickly as possible. So we're going to get the first 5,000 in there, make sure that all works, and then we're going to immediately start on getting everyone else in there. So we're going to make every effort to make sure we get the entire waiver population in there as quickly as we can.
And there was another question that had just come in on stimulus checks. And the stimulus checks is federal government, and So that makes it out of my wheelhouse, obviously. But it is also, we have seen some guidance around stimulus checks and if you're getting Social Security. And we all know there's various ways that you get Social Security. So and I will have, give this to Heike so that she can post to the website. I have seen that there are certain ways that you get Social Security. If you get Social Security certain ways, you should be able to get the stimulus check without doing any other work. But there's one category where they haven't got that figured out yet. So what I will tell you about the stimulus checks, what I'm seeing from the federal government is that they are really trying hard to figure out how not to make any extra work for anybody in order to get these stimulus checks. But I will try to find where I read that and get it to Heike so that she can post what we know about stimulus checks to our website. And she's taking notes, and we'll make sure I follow up because she's good like that. I did want to, I can run over and check again real quick, but I just wanted to let you know how grateful I am for you all taking the time to call in. This is our fourth call. My goodness, we've been doing this for a while. And it's, like I said, our peak date did I say our peak date?
No.
Let's talk about peak date. Our peak date in Missouri right now is estimated to be April 21st. And I know that when a lot of you look at models, and I know you are, about peak and what to expect, we really feel like in Missouri that our peak date's really going to be more of a leveling off date. So April 21st is when we level off, but we probably won't start see a decline in the number of positives on April 22nd. So what we feel like in Missouri right now is that we'll get to April 21st, we will kind of level off for a while, and then we'll start to see that decline. So I just wanted to make sure you guys understood our peak date right now in Missouri is April 21st, but that's even if you hear or have learned anything about flattening the curve, you know when you flatten the curve, you're stretching it a little bit. And that's really kind of our goal right now, is to flatten that curve. So we will be stretching it a little bit. This is an improvement over the previous peak date in Missouri of May 15th. So kudos to everybody who is following those social isolation protocols. And I know that we in the DD community have been doing that for a very, very long time. And I know you guys have done a really good job of that. And I know that you really work hard with your staff to make sure that they understand how important social isolation is. And please, please continue to do that. But what I wanted to get to is I'm just really proud that these 4 calls today we have over 629 callers on the call. We know that there's probably more people than that on the call, actually. This is our lowest number, but that's okay. That's 629 people we're reaching. We've been over 800 on these calls. So I do really appreciate you taking the time to hear what we have to say. I appreciate you taking the time to send in the questions so that we can help keep things as clear as possible. And I appreciate your flexibility, because every day this changes for us. Every day we learn something new. Every day we change what we did the day before. So I truly appreciate you understanding the need to be flexible in this time. Just know that from the department standpoint, we are always going to put the safety of our individuals first, and we're always going to put the safety of our staff first. So those are the things that when we make decisions, we want to make sure those are the things that are at the forefront of every one of those decisions. And that's why we're doing things the way we're doing them right now, and we appreciate your support in that front. I don't really have anything else. Did you see any other questions, Gary?
There was just some clarification that Station MD was not for individuals just getting general revenue POS services. That's correct. It is just for the Medicaid waiver folks.
And again, this is a start. We have to start somewhere. So it doesn't mean that we don't get to that point in the future, but this is our starting point right now, and we've got to be able to gauge their capability, which we don't have any reason to think it won't be excellent, but we need to gauge their capability and bring them on slowly. We don't want to take something like that down. We are so excited about Station MD and about the opportunities that affords us in further keeping individuals that we support safe and healthy and all those things that we want to do. So, Wendy, Gary, anything else?
Mm-hmm.
All right. We did it in about not quite 30 minutes today. Again, thank you for all you're doing. Please know that everybody in Jefferson City considers you a valued part of this healthcare system. Everybody considers the individuals that you are helping us support, or maybe you yourself are one, a valued part of the support system. And we will get through this. There is an end to the tunnel, we promise. It's just, it's still going to be a long month, and it's still going to be a rough couple of months too, but just please stay focused. Thanks, everybody. Bye.